Okay, good morning all. Now I'll be starting with my lecture. Okay, so this occupational, I'll be talking about the occupational health. Okay, so this occupational health will be having few of the lectures. Okay, so why we need occupational health, isn't it? So there are so many diseases, there are so many type of the accidents which we face because of the while working, isn't it? During different type of the occupation, there the workers comes under different type of the accidents and different type of the disease. So that is why the occupational health is one of the very much important topic. So can you hear me? सुनिरहेछ नि सबैले?
हाँ मैम।
Okay, so now I'll just begin my lecture. Okay, so when we talk about the health, when we talk about the preventive health, you all know the definition, right? So you all know what is preventive health. So how to define preventive health? You all know. Likewise, the definition is same for the occupational health. So occupational health is a more or less similar type of the preventive health, but it belongs to the workers in different type of the occupation. So when we talk about the occupational health, it is the promotion and maintenance of the highest degree of physical, mental and social well-being of the workers in all occupation. It denotes all the occupations. Okay, it is the definition is same. We what we require is the complete physical, mental and social well-being of the workers. And um, prevention among workers of adverse effects on health caused by their working condition. While working, while the people are involved in different type of the occupation, there might be not suitable type of the environment. Maybe the workers may be facing the problem related with the ventilation, maybe the problem related with the light, not proper light. Okay, maybe they will be having the problem with the machines. Maybe they are just provided with the damaged machines or not properly working type of the machines. So these all things definitely affect the working environment of the workers in the occupation. So these all things are necessary to talk about. So protection of the workers in the employment from risk resulting from factors adverse to the health, and placing and maintenance of workers in an occupational environment adapted to the physical and mental needs. So this all means that the the environment of the working environment of all the occupations should be healthy, it should be proper. Okay, whatever things that affects the workers, it should be treated. That is the main thing. So, why is occupational health and safety important? So, what happens is all those different factors, all those factors are important as people definitely get exposed to the different type of the health hazards while working. Like, please unmute, okay, everyone, please unmute. So what happens is during the working environment, people will face the different type of the health hazardous thing, like dust, different type of the dust, gases, noise, vibration, high temperature or low temperature, isn't it? And different type of the organisms. This all the factors, this all the factors will definitely affect the health of the workers. So that is why it is required. So if all these things at the working place is not proper, people will definitely will have to face the different type of the disease. As we talked, but if the people will have the dust, a regular exposure of the dust, and if they are not equipped properly, if they are not provided with proper equipments, then they will have different type of the respiratory infections, isn't it? So likewise, if they are exposed with different type of the gases, that gases can definitely affect the health. And if there is loud type of the sound, and if that is not if that is not stopped, that loud sound is not stopped, then definitely it will affect the hearing, definitely. And also related with the vibration also, there can be health hazards, and also with the high and low temperature also, it can lead into the different type of the diseases. So work related accidents or diseases are very costly and can have many serious direct and indirect effects on the life of the workers. And also, if the workers are affected, then definitely their families can also be affected. Okay. So for workers, some of the direct cause of an injury or illness, when they, while in the working environment, if they face certain type of the injury or diseases, then there will be the loss of the income. One is the loss of the income, possible loss of the job, or healthcare costs, and pain and suffering of the injury or illness. Like for example, if the person falls, or if they just cut some of the limb, if they cut their hand, then definitely for the treatment of the cutting injury only, they have to pay a lot of money. And because of loss of the limb, there might be loss of the job and loss of the income, definitely. And the workers will suffer from lots of pain and suffering from the injuries. So this can be the cost of the occupational injuries. So some of the indirect costs for the employers, it is like definitely the employee get affected. One is the employee, the worker will get affected. And other person that can get affected if the workers are if the workers face certain type of the injury, is then the definitely the employers who give the job, they are also affected. So see here, injured or ill worker has to be replaced, and new worker has to be trained and given time to adjust. What will happen if the boss, the main boss of that occupation of that work, they need to replace the worker who got ill, isn't it? They have to bring the another worker to the job. And if the another worker is brought to the job, that new person has to be trained what to be done in that work. And definitely while giving the training, there will be the waste of time for that industries. And also for the new, when the new person comes to the working environment, then definitely there will be effect in the production, the production will be decreased during that time by the new worker in the early phase. So and also poor health and safety conditions in the workplace can also result in poor public relation. If we hear, if we start hearing that in this industry, in this factory, the so many workers have been is having so much type of injuries, like for example, if that is a if that is the industry of some chemicals, and the most of the workers is having some burn in the hand or having some respiratory tract infection, then in the surrounding environment, definitely this will give the negative impact of that industries, isn't it? We can just keep on saying that there can be the rumor saying that the in this industry most of the workers are having the disease, like that. Okay. So and also, accidents often arouse the concern of fellow workers and influence labor relation in a negative way. Definitely, the worker, okay, the workers and the main employers, okay, the worker and the employers, they can have the negative type of the relation if such thing happens. So now talking about the global burden. Now, what is the full form of ILO? Anyone? What is the full form of ILO? It is the Q, ILO को full form.
International Labor Organization.
Yes, it is the International Labor Organization, right? So, what does the ILO do? Do you know? Any one of you? What is the main work of ILO? The main work of the ILO is they do have certain type of the policies. Okay, they do have certain type of the written policies which all of the working environment, working place need to be followed. Okay, like if like for example, if the person, if the worker gets injuries or have some diseases, the industry need to just take that person to the hospital for the treatment, like that. And also they need to provide certain days of the holiday, certain hours of the working shift according to the job. Okay, like that, there is the policies that is made by the ILO. And in context of Nepal, there is a separate ministry for this thing. Okay, and what is that known as? Do you know, like, for all the workers, what is the like name of the ministry in context of Nepal? के भन्छ? कुन मन्त्रालय?
From Mantralaya.
Yeah, I know there is a Shram Mantralaya. Yes. So this ILO is the International Labor Organization. Okay. So what ILO has said is, ILO estimates that each year at the global level, more than 340 million workers meet with the occupational accident. Okay. Whereas 160 million are suffering from the occupational disease. And 1.2 million workers die annually due to the occupational disease or accident. So why so many people are having the, what do you think, why so many accident, disease, or people are dying in the working environment? What can be the main cause? It is because of the cure. What can be the reasons? Huh? What can be the reasons? भन न एउटा दुइटा.
Poor working environment.
The main problem is the environment, and the main problem is related with the working environment. Wait,
के भयो भन्दाखेरि डक्टर मनिकालाई एड गरिदिनु पऱ्यो भनेर भन्नुभयो. तिमीले कल गर्नुभएको थियो.
कसरी गर्ने?
त्यही हेरेको मैले देखेन.
त्यसलाई पनि बिचमा आएर कसरी एड गर्नु? त्यो त्यही साइटबाट डाउनलोड एड गर्न मिल्छ. छैन,
कोही आएकै छैन नि.
यहीँ तल आएर सुन्नाऊ भन्नु बेस्तै नै हुन्छ होइन? ओके. Yes. So main is the working environment. You know? So there should be a proper working environment. Now talking about the Nepal scenario, the concept of occupational safety and health in Nepal is in its initial stage. Okay. So as we told that there is a separate mantralaya related with all these industries and workers. So that is known as the Shram Mantralaya. Okay, and this Shram Mantralaya, with a certain period of time, what they do is they just provide certain type of the written policies. Okay, like which ILO has done, like that only from this Mantralaya they provide this thing. And from that only what they do is they just provide the, like how many hours of the work for certain type of the disease, how many holidays, okay, on what condition this religion should get holidays. You all know, we've been hearing that यो वाला कास्टको लागि भनेर चाहिँ there is a holiday for these days, like that. So all this thing will happen, and along with that, if the workers get sick, it is provided, and in some type of the job pension is provided. Okay, and in certain type of the disease there is regular health checkup need to be done. All that thing is given by the Shram Ayog, that is Shram Mantralaya. So but what is the problem in context of Nepal is, most of the workers, isn't it, like most of the workers who work in the industries and factories, they are usually illiterate and with a very very low socioeconomic status, and they are completely lack of awareness with what they don't know, they don't know that what they need to be provided by the working environment in from the place where they are working. They don't know all that thing, and they are just skipping all that thing. So this thing has to be considered by the government. So 11,779 Nepalese aged 15 years and more are engaged in one or other type of the occupation in context of Nepal. But this is of the very like few years back data. Okay, and 74% are entered in for the agriculture job, whereas 26% are involved in the non-agricultural sector. And each year, approximately 20,000 workers suffers from accidents at workplace. Okay, and around 200 lives are lost in context of Nepal. That is the data from the 2011, and this is the context of the Nepal. So now talking about the occupational environment. Now we'll begin with the different type of the topics. Okay, we'll begin with the different type of the topics. So in context of the occupational environment, one is definitely man is linked with the physical, chemical and biological agent. Okay, the workers are linked with the different type of physical, chemical and biological agent, whereas another is man is linked with the machines, and next is the man with the man. Okay, man, one employee is another involved with the another employee. So when we talk about the physical type of the agents, okay, physical environment, there are different type of the physical environments. Okay, the physical factors in the working environment which may have a adverse effect to the health, that are like heat, okay, cold, humidity, and definitely the air movement, and also the heat radiation. Some of the jobs are linked with the glass, and steel. In that environment there will be the heat radiation. They have to work in the very high heat room. So along with that, light, noise, vibration and ionizing radiation, this comes under all the physical agents. So this factor, these different factors will affect the health of the workers, and also the efficacy of the like production, efficiency of the workers. This will affect like that. Now whereas in chemicals, there are different type of the chemicals, toxic dust and gases that can lead into the health hazards, and this can mainly affect the respiratory illness, and some can also causes the all those skin related issues like about eczema, dermatitis, all these things. Whereas talking about man and machines. So in industries or factories, the use of machine driven power with emphasis on the mass production. There can be like protruded type of the machines, or unguarded machines, or move. There can be like dangerously moving parts of the machines, and poor installation of the machines. So there can be lack of the safety measures, and also lack of the like timely changing of the new machines. This thing can be avoided, and because of that only, that this can affect the health to the workers. Now next is the man and man. So this man and man environment, this will affect the numerous psychosocial type of the factors. Okay, especially like about mainly there can be related with the job satisfaction, isn't it? Another is the leadership type of the style. And the seniors can just dominate the juniors. This thing can also affect, and also the incentive salary can also be one of the factor in the man and man type of the environment. So these are the sort type of the things. So now talking about the occupational hazards. So this is important. Okay, occupational hazards, there are like physical, chemical, biological, mechanical, psychological or psychosocial. So these are the different type of the occupational hazards. So now first of all, talking about the heat. There are so many type of the occupation, isn't it? There are so many type of the job where the workers have to just do the job in a very very high heat. Okay, so most common physical hazard is heat. Okay, one of the most common physical hazard is heat, and the different type of the health effects because of the heat exposure is the like burns, burns, heat stress, heat exhaustion, heat stroke, and heat cramps. So these are the different type of the health issues which are faced by the workers who work in the high heat. Okay, you might have seen, there are some people who are like especially for the, we can give the example of the farmers, they usually work in the high heat. So what happens is they'll have a problem with the skin burns, okay, and especially to the workers who are working in the this Dubai, Qatar area where there is high heat, high temperature, they can face with the heat stroke and heat cramps. So now, indirect type of the effect of the heat is decreased efficiency, increased fatigue, and enhanced accident rates. So definitely when we need to work in the very high heat environment, the production level will be less. We easily get very tired or fatigued. And definitely if the working hour is more, there is chances of facing the accidents. So uh-huh. Like many industries having local hotspot. Hotspot means very the room where there is a very high temperature. Okay, they need to work with the fire. Okay, like ovens or furnace, like that. So the hotspot area, like in the industry of glass and in the industry of steel industries, this thing can happen. Okay. Now, high temperature are also found in mines. You know what is mine, eh? So, high temperature are also present in the mine, and the physical work under such condition is very much stressful and impairs the health and efficiency of the workers. That is for sure. Now, next is cold. Okay, there are some jobs where the workers need to work in the very cold environment. So, when they need to work in the cold environment, the common health issues they face is chilblains, erythrocyanosis, immersion foot, frostbite, all these things. So, do you know what is chilblains or inorban? Do you know? Chilblains and kyo? Anyone? Sunira Hasai, can you hear me?
Yes, ma'am.
What is chilblains?
थाहा छैन म्याम.
So chilblains are like, I think some of you might also have faced, usually in the December or January time, the finger will be swollen, red, and it will be very swollen, and it will be, when it is like warm, when the hands and feet are warm, it becomes itchy like that. Okay, that is chilblains. So usually the worker who need to work in a very cold environment, they face the commonest problem is chilblains. Along with that, if they just need to walk in the cold water, very cold water or icy water, then there will be the immersion of the foot, and also there is chances of having the frostbite, and because of that they need to cut their limbs. Okay, because of the vasoconstriction they can face with the frostbite. So now next is the light. So some of the workers, they need to work in the high light region. Okay, so in such type of the job, workers are exposed to the risk of poor illumination or excessive brightness, and the main problem is related with the eye only. So what will happen is there is the eye strain, about they feel some type of the pressure, difficult to open eye, or some type of heaviness in the eye. Okay, so that is the eye strain, headache, eye pain. Okay, and excessive lacrimation can occur, or congestion around the cornea, and eye fatigue. And also the chronic effects on health includes the minors nystagmus. So I hope all of you know what is nystagmus. थाहा छ है nystagmus भनेको के भनेर? Nystagmus भनेको थाहा छ है सबैजना, it is the involuntary movement of the eyes. No, it is the involuntary movement of the eyes, just moves right and left. Okay, so the workers who work in the mines, okay, they face usually with the miners nystagmus. Now another is glare. So I hope all of you know what is glare. About usually glare is when we in the traffic we face the glare in the night time, isn't it? So there will be the excessive brightness, that is what is known as the glare. So when there is excessive glare, then the main problem is there will be the discomfort in seeing. Okay, discomfort in seeing and irritation and visual fatigue can occur. So intense direct glare may also result in blurring of the vision, and as there is a high glare, then there is chances of having the accident. So definitely the required amount and a suitable amount of the light should be provided for the workers. Now next is the noise. So I think you have already gone with the noise pollution, no? So noise, when the workers are faced with high exposure of the noise, then there is a chances of auditory effect also, and next is the non-auditory effect. So auditory effect means it is the harm in the hearing, isn't it? It is the harm in the ear. So there can be chances of having temporary or permanent hearing loss, whereas when there is non-auditory effect, it usually affect the systems. Okay, so there can be increase in the blood pressure, headache, and the person might face with the nervousness, fatigue, and also there is like, because of high noise region, there is like interference with communications. Okay, there is difficulty to understand what the other person is saying, and definitely there will be the decreased efficiency and annoyance. Now next is the vibration. So vibration, and especially the workers who work with the drilling. Okay, so vibration, this is also one of the physical hazard. So it can range from 10 to 500 hertz. Okay, 10 to 500 hertz, and this is especially faced by the workers who work with the drills and hammers. And this vibration usually affect the hand. Okay, hand and arms. So what will happen is, after some months or years of exposure, the fine blood vessels of the fingers may become increasingly sensitive to spasm. So there will be the spasm after certain period of the exposure, and then because of that spasm भएको भएर चाहिँ there will be the change in the colors of the fingers. It will turn into white. And exposure to vibration may also produce injuries of the joints of the hand, elbows, and shoulders. Whereas the people who work in the ship, I know people who work in the ship, they will face with the whole body vibration and whole body type, vibration. Now next is the ultraviolet radiation. Usually this is faced by the people who does the welding. Okay, who does the welding work. So see here, occupational exposure to ultraviolet radiation occurs mainly in arc welding. You might have seen, the workers who just do the welding of that stairs, or making all those different type of the like के भन्ने अब specialist stairsहरू हुन्छ, and also tablesहरू, they all face with the welding. And also when the people who make this different type of statues, they work with the welding. So they just get exposure with the ultraviolet radiation. So what will happen because of the ultraviolet radiation is, on skin there will be the thickening of the skin. I know because of all those exposure of the welding, there will be the change of the skin texture and darkening of the skin, erythema, and also because as it is a UV radiation, it can lead into carcinogenic. There will be the cancer of the skin. And radiation mainly affect the eyes, causing intense conjunctivitis and keratitis. Please remember this name, welder's flash. So the people who work with the welding, they can affect with the eyes and lead into conjunctivitis and keratitis, leading into welder's flash. And symptoms are redness of the eyes and pain. These usually disappear within few days and with no permanent effect on the vision and affecting the deeper structure of the eyes. It does not affect deeply. So next is the ionizing radiation. This is the another type of the radiation. Okay. So usually the worker who work as a radiographer, they are exposed with the ionizing radiation. So see here, ionizing radiation has increasing application in medicine and industry. Example, X-rays. So certain tissues, so let me just go through another slide. Okay, the radiation hazards, this topic has already been covered, I think, right? यो तिमीहरूलाई radiation it has already been taught, right? ए बोल न.
Yes, ma'am. Pause a second here.
Okay, so the different type of the radiation hazard, that is like a genetic changes, and it definitely affects the gene and malformation. Okay, and you also know there is a chances of having infertility, isn't it? And also leukemia. Leukemia is one of the commonest radiation hazard. Okay, so these are the different type of the radiational hazards. So next is the work-related musculoskeletal disorders. So while working, while continuously working in certain environment, there will be certain pain or discomfort in joint or limbs. Because of that only, the workers can face with the different type of the joint problem or different type of the muscle problem, that is known as the tendonitis, epicondylitis, bursitis, okay, trigger finger, carpal tunnel syndrome, and back strain. So what will happen to them is there will be the painful or discomfort with the joint or muscle, and some might find the tingling or numbness in the these fingers, okay, and turning off white, as we just said before. And there is continuous pain, okay, stabbing type of the pain or shooting type of the pain, swelling and inflammation, okay, and stiffness of the muscles. So these are the different type of the symptoms or signs of the MST. So now talking about the chemical hazard. Okay, so talking about the chemical hazard, there is hardly an industry which does not make use of the chemicals. Definitely in most of the industries, they use the chemical to just produce their production. For their production, they definitely use certain type of the chemicals, definitely. And all the workers have to be like careful while using the chemicals. They need to follow the different like preventive measures. The chemical hazards are on the increase with the introduction of newer and complex chemicals. So there are different types of the chemical hazards that can occur. That is, one is the local action or by the inhalation of the chemicals, or definitely by also the ingestion of the chemicals. So among these three, while talking about the local action, okay, so while using the chemicals, while using the chemical, they can just pour into the hands, okay, pour into the hands and react on the skin by forming the dermatitis or eczema or ulcer. And if there is like a regular exposure to the skin, it can also lead into the carcinogenic. Okay, so see here, by irritant action, some of the like irritant type of the action, some chemicals causes dermatitis, eczema, ulcer, and cancer. The example is the alkalis, lime, and different type of the oil. By an allergic action, when it is exposed and causes certain type of the allergies, it can lead into dermatitis, especially by the formaldehyde or resins. And by absorption causing systemic effect, if these chemicals are absorbed in the skin, like some chemicals, particularly the, remember, okay, that is the aromatic nitro and amino compounds such as aniline, this can lead into the carcinogenic type of the effect also. So when the chemicals are inhaled, okay, when the chemicals are inhaled, dust are produced here. Dust are produced in a number of industries, like in the mines, quarry, or pottery, textile, wood, or stone working industries. So we'll go through all this. Okay, there is a separate chapter of pneumoconiosis, because of which, with the inhalation of the dust, different sizes of the dust, there will be the different type of the disease. You will be going through that later on. There is a separate class for this only. And also the gases, okay, gases, the common hazards are, see here, the simple gases like oxygen, hydrogen, asphyxiating gases like carbon monoxide, cyanide gas, sulfur dioxide, anesthetic gas, chloroform, okay, ether. This carbon monoxide hazard is frequently reported in coal gas manufacturing plants and steel industry. So these are the different type of the chemical hazards. And also the metals and their compound, okay. So metal and their compound are, the mode of the entry of the metal is by inhalation, okay, and it affects, depend upon the duration of the exposure, for how long it has been exposed by that particular metal, okay. The industrial physicians should be aware of the toxic effect of lead. You know lead, eh? Lead is very poisonous. So lead, arsenic, and cadmium, cobalt, these are one of the very much common type of the metal, and mercury. So this thing you should know, these are the one of the good example of the metal leading into the chemical hazards. Now next is the ingestion. So definitely while working, some workers, some workers, they usually don't wash their hand. Okay, so while eating, okay, or while just using cigarette, or while just doing some work, they just swallow the chemicals. Okay, now see here, occupational diseases may also result from the ingestion of chemical substances like lead, mercury, arsenic, zinc, and others. And these substances are swallowed through contaminated hands, food, or cigarettes. And most of the ingested material is excreted through feces, and only a small portion may reach the general blood circulation. And when it leads into the circulation, it will lead into the different type of the health hazards. Now next is the biological hazards, okay. So the workers, the workers, they might be exposed to different type of the organism, okay. They can be exposed into the organic with the organism, especially worker who work with the, who work in the agriculture sector, and who work in the labs, okay, different type of the labs, they get exposed with the organisms. So now see here, workers may be exposed to infective agent or parasitic agent. So different type of the disease, occupational disease are brucellosis, leptospirosis, anthrax, okay, hydatidosis. So these are the tetanus. So these are the different type of the biological hazard causing occupational disease. So person working among the animal product or agriculture worker are specially exposed to the biological hazards. Yes, now next is the mechanical hazards. So mechanical hazard, 10% of the accident in industry are said to be due to the mechanical cause, okay. So as I told you before also, there are so many type of the machines, especially in context of the developing countries in Nepal, like Nepal, okay. The machine are not renovated, isn't it? So the machine can be protruded, or the parts might be damaged, or the production can be difficult because of all that thing that can lead into the mechanical hazards. Now next is the psychosocial hazard. So psychosocial hazard is, as we talked initially, if there is no any if there is no proper environment, if there is no proper working environment, if the surrounding is having so many type of the issues, then the workers can have the different type of the psychosocial hazards, like frustration, lack of job satisfaction, isn't it, insecurity, or because of low incentive, because of less salary, there might be some issues also, I know, among the workers. So these are the different type of the psychosocial hazards. Now, the health effects can be classified as psychological and behavioral changes, and another is psychosomatic ill health. So, in psychological and behavioral changes, it can be aggressiveness, anxiety, depression, okay, alcoholism, drug abuse, and sickness, absenteeism. Whereas psychosomatic ill health include fatigue, headache, pain in the shoulders, neck, and back, okay, and developing of the peptic ulcer, hypertension, heart disease, and all these things are the psychosocial type of the hazards. So this much for today. Is my lecture clear? So this is just the introductory part. Okay, this is the introductory part, and you should know about the different type of the hazard. So are there any queries?